there?
The recovery process following bunion surgery really begins when you're rolled out of the surgery suite. And we've made this video to help you understand the recovery process step by step to optimize your recovery. In the hospital, most often you will have an anesthetic block in which the anesthesiologist has injected local anesthetic by the major nerves of your lower leg. They'll sedate you when this is done, so it's not really uncomfortable. What's nice about this local block is that it often lasts for 12 to 24 hours. Your leg and foot will be numb, in fact, and you may temporarily have a foot drop because your muscles will be anesthetized as well. But with time, the numbness and muscle weakness go away. During the actual surgery, the anesthesiologist will sedate you as much as you like. If you have any pain during surgery, a light anesthetic will be administered. Bunion surgery typically lasts for an hour or an hour and a half. After surgery, the patient is rolled out of the surgery suite into the recovery room, and that's where you'll wake up and where you'll really become in contact with the nurses around you, and then you'll go to an area where you'll even recover more. You'll sit in a chair. While you're observed really closely in the recovery room, as the medications wear off, then you're actually prepared to go home. While some patients are kept overnight, most go home to their house or, for out-of-town patients, to a local hotel. It's common that our physical therapist or the nurse will help you get a hang of walking on crutches or a walker using your bunion shoe. Commonly, we'll see you the next day or a couple of days afterwards to change your dressing. Often the foot bleeds for the first 24 hours, and don't be concerned about this. You can just actually wrap extra gauze and some gauze pads around it that are given you by the hospital, and that can be used to just hide any blood from your vision. But I just want to reassure you that in almost every case, all the bleeding stops at 24 hours. And when you next come to the office, we'll do a new dressing change and give you a nice clean dressing. We want to do your dressing changes. Please don't change it yourself. You can reinforce it, but don't change it. So let's talk about the first 24 hours after surgery. First of all, elevation and ice is very important. One of the things that I like to do is use a couple of pillow cushions or sofa cushions and stack them on top of each other. As you see in this video, a pillow is put in the crook of the knee, and one can then lie with their head and back flat on the bed or on a couch during the daytime, and you use this same setup at night if you go to your bedroom. Secondly, ice on the area of surgery is very important. We want you to ice it unless we tell you it's contraindicated. You can drape ice over your foot, and actually some people will use a large sack of mixed vegetables or frozen peas because the cold lasts for a long period of time and can be refrozen over and over again. And fourth and most importantly, let's talk about pain control. We're very concerned about that. We're going to give you plenty of pain medicine to control, I think, 80% or 90% of your pain. We can't make it go away, but we want to relieve it as much as possible. For some, it seems like we've given them way too much, and for others, it seems to be the right amount. Often, you're at home with just your spouse or some member of your family, and we don't want you to be uptight about the fact that you're having some pain. We want to make you as comfortable as possible after surgery. Now, the next facet of your recovery process is how you walk. And when you were at the outpatient surgery area, either a nurse or a physical therapist will have instructed you on the use of crutches or a walker. It's important to try to walk on your foot, on the outside of your foot, or on your heel, because you don't want to bear weight on the area where surgery has been performed. Now, initially, you may be non-weight bearing because of your block, but as your block wears off, you'll use crutches or a walker, and I would guess within the first 2 to 7 days, you'll get walking just on your foot and really won't need the crutches or walker to get around. Typically, we'll want to see you every 10 days or so in the office for visits. At these visits, we'll take x-rays and we'll apply new dressings. We actually want to do these dressings so that we can hold that toe in exactly the right position so that it doesn't deviate too far one way or the other way. During the recovery period, often at 6 weeks after surgery, is when we'll remove most of the hardware, especially the screw and pin at the site of the osteotomy. The hardware is removed in the office under a local anesthetic, and it's usually in an uneventful process. Patients tend to really worry about this, but I suggest you don't get too uptight. It's really not that bad. It's a good idea, though, to have someone drive you to the office on this visit and to take the rest of the day off and take it easy. Motion is important, and we want you to recover as much motion as possible. And so, at 10 days to 2 weeks after your surgery, we will make sure that you start motion of the great toe. We have a handout for this, but we want to show you actually how we do the motion on the great toe, because either you or your spouse will help you with this. What we do is we grasp the toe at the base of the toe and we move it in an up and down fashion. We push it up and we push it down. You'll need to do this several times a day. If you have trouble getting your motion, we may order physical therapy to assist you, but that's usually after your dressings are discontinued. So let's talk about bathing and showering. Bathing is out just because it's very hard to get in and out of a bathtub and protect your dressing. Showering is really the way to go during this 8-week process. And as you can see in this example, this is a cast protector, but we use it for our bunion dressing as well. And it grafts the calf and keeps water out of the dressing area and away from your foot while you're showering. Let's talk for a moment about shoe wear after surgery. You started with this bunion shoe, which you'll use for 6 to 8 weeks. We do this because there's a dressing and because your foot's swollen. The next step is an open-toed sandal, and I have a couple examples, such as a Birkenstock and such as a Tiva, which are both very nice sandals which can be used after surgery, and there's a lot of room in them. As your swelling goes down, it's important to use a shoe that has enough room. And a New Balance tennis shoe is a perfect example of a good tennis shoe because it comes in widths and it has a wide toe box. Also, a men's tennis shoe comes a little wider than women's shoes, and the whole point is to keep pressure off of the bunion repair. The longer you protect it, the greater chance there is of a great result. And lastly, as you move on to closed-toed shoes, this isn't highly fashionable, but it's certainly a roomy toe box, and this would be an early pick. Does that mean you can go back to fashionable shoes later? Well, you probably can, but the longer time interval that you have between surgery and going back to fashionable shoes, the more protection there is for your bunion, and the better chance there is of success. One of the more common questions is return to other activities after surgery. At 8 weeks, when your dressings are finally discontinued, that's the time that we start walking aggressively, usually in a sneaker. By 12 weeks, speed walking is in order, and jogging soon after that. I believe really that by 4 months, hopefully you can be back doing whatever you wish as far as sports activities. A lot of this depends on a person's age and on their residual swelling. What we've tried to do is give you some examples of the important aspects of the recovery process. Certainly there are always risks that occur with surgery and after surgery, such as infection and other complications, but cooperation, I believe, is the key to success. Certainly after surgery, your cooperation with elevation, with icing, with being careful with walking, with regular office visits and dressing changes, they're all a component to what I think we call the team approach. You and the nurses and the physicians working together to get an optimal result.